And next we have our incredible guest from the Netherlands. And Lucien Engelen, come on up. And Lucien and I have actually been Twitter buddies for almost 2 years. And today was the first day we met IRL, which is in real life. And I feel like I'm with an old friend, and I know you're going to be really intrigued and excited by what he's got to say today. So,
thank you again.
Very good.
Thank you.
Lucien.
Well, first of all, thanks for having me. Could we get the slides up, please, here as well? It's a lot easier. So that's, by the way, not me, although the resemblance with the bow tie might seem like it, but it's the little guy that's resembling the way that we at our innovation center in Radboud University try to work. We're granted from our board to ask silly questions. So the thing you get back is silly answers, as you can imagine. And the interesting thing is that when you start asking questions to the people who it matters the most, which are the patients, you get completely different answers than you thought of. And that's one of the things that we do. I have a quarrel with my board about our mission statement, which is the one in blue, to have a significant impact on healthcare. And I write this mission statement within brackets. What about care? Why do we aim to improve healthcare if, just like Mike said, if we were able to improve health, and with that, drill down about 50% of all the stuff that we're curing? So that's a problem. But to be honest, it didn't fit in our business model yet, at least in the Netherlands. Maybe it's over here, but I don't know. So what we do is to try to have a lookout on what technology is going to bring us, how in the next 5, 10, 25 years, we can translate that into the steps that we should take in health and healthcare. Because whatever research that you're looking into, it takes us about like 7 or 17 years to implement those kind of things before they get mainstream. And that's interesting. So I brought a photo of my team, as you can see, right out of the box. Great passion. And the direction that we're heading, no idea. Because that's the reason about this little sticker at the box. We ask patients at the very first stage how we can help them. And the next thing we do is try to mold that in with all the problems that my colleagues ran into and try to create good solutions for that. The physicians in the audience have something to do with this oath. This one is 500 BC. But the thing is, if you really read it, there's no mention of the role of the patient whatsoever. The godly powers of the physician are broadly mentioned, and they should. But whenever the physician is in doubt, you should keep your patient uninformed. Sounds like a bit like nowadays, right? So fast forwarding a bit. This is a great painting called The Doctor's Visit. Just pay attention to the lighting. The physician in full light, the patient a bit less. And if you have a good look, you can just see the father of the little guy at the back end, putting a hand reassuring up the shoulders of the mother. No role whatsoever. Fast forward again. The internet came. And the internet changed everything. Every branch that we look into, might it be travel, music, retail. In the Netherlands, 98% of all people run electronic banking. And we still say patients cannot do things online. Go figure. So the next thing that's going to happen at the intersection of technology and patient empowerment, that's where the big change is coming. There is a reason why Apple and Google and TELUS and all the rest of them are trying to get a stake in healthcare, and they should. Because changing healthcare from inside out is not going to happen. At least that's our recollection at present. Technology is going to evolve. This is one of the things that we're working at. It's a little Band-Aid that you put on your chest. And with it, we can measure 9 vital signs remotely through the internet. And a couple of months ago, I was able to, one of the famous radio hosts in the Netherlands was running a world record attempt to create 200 hours continuously radio to measure him from Nijmegen. One of the other things that's coming online very soon is the Scanner to Scout. It's a crowd-funded campaign from two people from Belgium originally in Silicon Valley. And they now put away like 8,000 investigational devices. The thing was, by the way, inspired by the medical tricorder from Star Trek, you know, Dr. Spock. But it really does, in terms of, with this, you put this thing up to your temple, and it measures your blood pressure, the upper one and the lower one, your heart rate, even your body temperature, and also the oxygenation level of your blood, with a little device. So that can change a lot of things. The other thing that they're working at present is a little disposable that you can take your urine analysis at your own home. You put it in this little pot, don't have to bring it to your family doctor again, and then wait 60 seconds, take a picture of it, and within 4 seconds, the 12 most common urine analyses have been run. That's changing healthcare, also from all the stuff that we're doing. And things become smaller and smaller. This on the ICU, big machines. We're now testing from Sotera Health, a mobile ICU, so we can monitor patients in the general ward from the ICU. A day and a half earlier, we can send them to the general ward. The next step with this patch of us, we can send them maybe even a day and a half earlier back to their own homes, in their own environment. Because the reason we're keeping them is just to find out whether their temperature is increasing. We'll do, by the way, the same the other way around. Pre-operative, we can change that as well. So the thing is, things are getting smaller and smaller. This is a little patch that you can wear at your wrist. Take 2 of them and you got a 3K EKG. Working with 3D printed spirometers that you click on your iPhone. Things getting smaller and smaller. And the next year, this year actually, 2015, is going to show an explosion of all kinds of wearables. From the Apple Watch, indeed, helping people, but also stuff like Google, working on a contact lens that measures your glucose level for people with diabetes in the contact lens, sending it through the iPhone to the pump or whatever. That's what's happening. The next thing that's going to happen is people start to implement stuff in their own body. Small RFID chips, like we do with cats and dogs and horses. And we even could take our medical records on that little thing. And just from wearables, I coined it recently, this development insidables, because we now are going inside of people. And we haven't seen anything yet. Because from spot measurement, we now go to continuously measurement. And just imagine that for the first time ever, as opposed to somebody getting sick, stepping up to the physician, we now will be present virtually in the data to scroll back the data to see what really happened. And that's an interesting era. Who of you has heard about Theranos, the company? Okay, and like 5%. So this is Elizabeth Holmes. She just turned 30 years of age. She's worth already, I think, like 9 or 10 billion bucks already. She created this company that with a nanotain of about 2 drops of blood is able to run 200 of the most common blood tests for $5.99, sending them off within 2 hours to your email box. And she's not doing this in a clinic, nor in a lab. She's doing that at Walgreens in Arizona at 90 locations already. And over the course of the next 18 months, they will start enrolling to 8,200 locations in the US. That's changing the equation. It's changing because also people can take their own blood by a robot computer that, based on ultrasound and all kinds of other technology, is able to, within 48 seconds sharp, take your blood. And if you have some kind of problem with seeing blood taken, you might turn away for a second right now because it's going to show it right now. So the Doppler is getting into it, and then the needle, within 2 seconds of that, with 100% accuracy, is able to find the right vein and take your blood. 1, 2, 3. That's it. So where are these kind of devices are going to be? Is Google indeed going to create drugs in terms of 23andMe with all the data that they have? I really do think. We haven't seen the end of it. This is the Organ Preservation Alliance based in Silicon Valley. And their aim is to, within 8 years from now, to restore your organs based on your healthy stem cells being taken away years ago to regrow your organs in your own body. Whether or not that's 8 years from now, I don't know. But this is getting really Star Trek-y, right? So the thing is, what is the hospital room of the future? Is this the one? I don't think so. I think this is the hospital room of the future. Clinics, supermarkets, locations in 5 miles from your own home, being able to run the 70% of the most common routines within the blink of an eye. So we're creating a nifty project like this one. I hacked a cart. As you can see in the middle, a little electronic device, and while you're shopping, it takes your blood pressure, it takes your EKG. And looking into your profile of here's my data, and I'll talk about that briefly, it says, no, this is the wrong alley, Lucien. You should take the other ones. So that's nudging. And we'd love to collaborate with Mike on that, not only on these uriners in Schiphol Airport, by the way. So the thing that we think that's going to happen, about like 70% of our routines that we run in a clinic or at the GP's office is going to shift in another way. Either from the hospital to the physician, from the physician to the supermarket to the people at their own homes. And technology is going to bring that. And that's a very interesting era that we live in. And that's a change from bricks into bytes. But the real challenge, as Leslie pointed out, is our behavior. Are we able to change our minds and our culture to really give the patients the power that they need into it? And luckily, at more and more places, stuff is going to happen and people are incorporated in that. But by the way, how many patients are in the room as of now? Being a patient, and the reason you're here is that you're a patient. How many? No hands? A few? So I've always learned that if somebody's talking about you at the table and you're not at the table, you're on the menu, right? So please, and don't let this be tokenism. Start incorporating your patient right from the start and talk to them, because they have the biggest value and they have more at stake at whoever. And I really think that if it's about innovation, in healthcare, we don't innovate. This is the work of Clayton Christensen from Harvard, and he keeps telling us in the newcomers on the market almost always win. And the innovation that we run is the yellow line. We tend, because of failure that we're afraid of, only take the next step when we know what the outcome is. That's process improvement. But in Silicon Valley, the red team publishes an app at Friday afternoon, and all of a sudden in the weekend, your world has changed. And then a funny thing happens. Then we start to work in what I call the neglect phase. Then I've written in an article that I named that the pre-gap. We start quarreling about, do patients want it? Is it agreed by the board? Is it getting reimbursed? Is the FDA approved? And all kinds of things. Meanwhile, the red team keeps going on, just like Theranos and the other companies. And all of a sudden, they have the FDA approval. Insurance companies will reimburse it, the board will allow it, and then we start to move. That's the moment in time when you're too late. This is what I call the Uberization of healthcare, because that's exactly what's going to happen. People and companies from outside of healthcare are going to change our model. And I can't wait, to be honest, because in no way we are going to change it ourselves. So this is true, I think. Meanwhile, our quarrel, somebody gets in. I knew this was going to resonate with you guys today. Huh? So what we did at Radboud is we brought in our Trojan horse. So we use technology as a Trojan horse to get into the departments. And within 15 minutes after that, we're talking about change of culture, about really incorporating patients into it. And this gives a bit of a flavor of what we're doing together with our very small project that we run in 30 days. Proof of concept is, just like Melinda says, in very short period of time. Is this going to fly? Is there a chance to or not? And then bring it on, and more as well during conferences. And I'm very happy to see Mike and Dave again, and so together with me, 3 former TEDx speakers on one stage. That's a great thing, and thank you again for that, Leslie. So the shift that we made, and Leslie touched on that earlier on, is that for decades we tended to innovate for patients. We tended to know what our patients needed. And one of my colleagues, who's a professor in oncology, told me a bit about 4 over and said, Lucien, I'm in oncology for 25 years. I know what my patients need. But we tended to ask the patients the same night, crying on the phone, how in the world it was possible that she didn't pick up those easy signals, because 50% of the signals that patients gave us were able to solve that very day, but she didn't know. Not costly, not high-paced on safety, for instance. So from working with patients, we're now tending into the next phase with all the modules that we've created, put them on the table and stand aside to look what patients, family, and their informal care would create with all the options that technology is bringing us right now. So the world is connected, as you know, and everybody's doing anything over. So how come when on a rainy September midday, I was joining one of my colleagues during his oncology rounds, stepping up to a little kid on the right side, Jente. Back then, completely bald, little hat on, wide eyes, being discharged of her chemo. And within like 6 weeks, she had to come back for the next round. And he asked her to come back within 3 weeks just for consultation. And the little girl asked him, what are you going to do then? And he said, I want to see you. That's just see how you're doing. And again, the little girl in bed asked, what are you going to do? And my colleague didn't get the signal. So the mother jumped into the discussion and said, she's asking, what are you going to do? Is there any diagnostic? Is there anything that she has to be present there? No, I don't. I just want to see her and hear how she's doing. So the little lady in bed says, well, then we can Skype, right? So I'm thinking that we're one of the fast forward innovative hospitals in the Netherlands. And with a blink of an eye, my colleague said, no. We're not going to do that. That's not secure, it's not possible, and all the reasons that you can imagine of. So that was the moment in time when we start creating a video conference platform, which we've called FaceTalk. That was prior to FaceTime from Apple, but so the names. And to give patients the ability with their own system, like an iPad, an Android, or a laptop computer, to in a secure way connect and reach out to our colleagues. And we can have tumor boards and stuff like that. So at first I attended to all the big video conference companies, asking them to get rid of this little box that is in between. I don't know that that is their business model. So that didn't work out. So we created our own system. And now, with the help of the government, and that's interesting, we're able to run these kind of things. And the government has issued that within 5 years from now, everyone in the Netherlands should be able to have access by video conference to their physicians. They started to reimburse it as if it was you being in real life after first visit, of course, that we have to change it. And the next thing is that they've issued that the standards would be created by the patients together with the industry and the healthcare institutions. And by now already, this is my colleague who's running the CLEFT team, 70% of all follow-up visits from people from all over the Netherlands are coming online and just have their consultation for it. And that's what we're enrolling now in the Benelux and Sweden, and hopefully very soon after. So if you're asking patients what they really want, they want to have their own personal health record. They want to know, they don't want to have a personal health record, they want to know what's out there about them. And they want to work in a community, just like Mike showed on Facebook and stuff like it, together with your peers and your family and also your caretakers, to discuss what's needed. And with that, to drill down the need to get into the office for everything that you need for it. And next thing, although they name it a little bit different, they want to be able to connect all kinds of e-health devices, from watches to step counters and stuff like it. So for that, we've created, this is by the way in the Netherlands, I don't think that's the same in Canada. On data level, everyone is acting with everyone, all but the patient, by the way. So in the Netherlands, we're working on these kind of electronic medical records nationwide for 14 years. So I said, okay, keep struggling. We ignite a new system, which is called Here's My Data. And what we are doing right now is that we share everything that we have of the patient as public healthcare institution to the patient themselves, giving them a copy of everything we have and giving them the opportunity to share it with whomever they think is needed. Might that be their healthcare insurance company, their family, other physicians, or to submit it de-identified for scientifically research. And that's interesting, because the thing that you see right now is that we're flipping the coin. That was wrong. And this is a bit of a peek of the back office in terms of all kinds of symptoms, but you also could connect your own weighing scale. I got this connected weighing scale to the internet for 5 years already. And the interesting thing is that there's this nut that I could share my data with my physician, no interest in it. That's interesting. But there was also this little nut to share it within social media, and I got something like 15,000 followers on Twitter, and I think, let's see what happens. So every morning when I hopped on my weighing scale at 6 a.m., prior to the moment in time when I got in my car, 10, 15 people said, a light lunch today. So that's about nudging. Just imagine what would happen if I would run that in a closed community, trying to stop smoking, quit drinking, or whatever. And that's the real thing. So what we are doing right now is that you might have heard of the Blue Button initiative, that patients will be able to download their data. We're flipping it around. We want patients to upload their data from all these devices and have their own data at first, and Dave will touch on that as well, and then bring it into the equation to share with whomever they think is interesting. And sometimes in your life you have to be lucky. This was not planned, but at the left side is Jeroen Tas, who's the CEO of Health Informatics of Philips. I bumped into Jeroen at a conference where I was speaking, and when I got downstairs, he was the next speaker. We met halfway at the stairs. And he said, we should grab a cup of coffee, because you're telling exactly what we as Philips want to be doing. It took us 6 weeks to get at one table with a cup of coffee. 7 weeks after, we presented at Dreamforce, the biggest IT conference in the US, in front of 140,000 people, our working prototype for COPD, built in 7 weeks on the platform that they've created together with Salesforce. And what we've done, for instance, with COPD patients, we connect the patients with this little patch. The data would go into the cloud. If the patients want to, they can see their real-life data It's a choice of theirs, not of the physician. And it also goes into the bigger system. And interesting for us is that this is the broader perspective. Normally, a COPD patient will get into the clinic, has a 4-hour consultation, 3 spot measurements, sending off to the GPs. That's your patient again. So now we got data from a whole week. And in terms of nudging, Mike, whenever the patient is for 2 days inactive, they can choose to be nudged by their family, by text, SMS, an email, or whatever system that they want to. And at the right, upper right, they can share with whomever they think is interested in. Even their employer if they think that's credible for it. So we're now working on different modules, and that's not for now, but it's taken off really very fast into it. And we've created this ecosystem, because interesting enough, at the front end of healthcare, we're trying to create a holistic approach. And at the back end, what we're getting back is from all these companies, data silos. So again, we're siloing healthcare, so creating solution at the front end, creating the problem at the back end. And I want to prevent the moment in time that I have to ask at the emergency department, do you own an iPhone or an Android? And if the patient says, I'm owning an Android, I say, that's the other hospital, too bad, sorry. So we needed a layer for that, and that's exactly what we created together with Salesforce and Philips. And for now, I just want to leave it like that. It's able for everyone to connect. Might it be pharma, healthcare insurance companies, patient community themselves, Apple. Apple has created this huge research community with Apple's Research Kit, and we're very proud to work on that. And that gives us the opportunity, for instance, like this, that is Buurtzorg, which is a home care company in the Netherlands, flipping around their model. They start with what the patient, family, and the formal care can do themselves, and then in the onion model, going broader and broader with it. They started back in 2007 with one team, 4 nurses. Now they got 9,000 self-employed nurses, treating 70,000 patients a day. That's changing the model. And together with my friends from Parkinson's Net, Bas Bloem and my colleagues, who created a system with 5 outcome components, already are able to treat Parkinson's care where the outcome is reimbursed and not the service or the things that they have been done. And that's massively changing the equation. They were able to drill down 50% of the hip fractures of people with Parkinson's. And as you all know, that is the ignition of a lot of other problems when they run into it. And they just published a paper in British Medical Journal. And we're now enrolling together with Kaiser Permanente in South and Northern California, this network as the very first start of this chronic care management systems. So is it a time to sit back and relax? Are we there yet? No way. We're not near it. I always talk about my 4D approach. Healthcare is getting democratized. People start voting with their feet. The second thing that's happening is that healthcare became delocalized, completely shifting the places that we're doing things within the next 5 to 10 years. And healthcare is going to get digital. Not only from a technological perspective, but if the treatment is not on Google or in a video of Mike, it's not true. And that's the other problem. And healthcare will be about dollars. Huge companies trying to get a stake on this market that everyone is being affected of. Some people will travel, some people like to listen to music. Everyone is at stake if it goes about healthcare. So we have to create new alliances, and we were very proud to be, together with Cambridge University, the only 2 outside of the US to start working with Apple at Apple's Research HealthKit. We've created this collaboration with Kaiser and with Philips. And the thing is that, and you're only existing really if Harvard Business Review writes about you, which happened happily in last December. So we're trying to create new partnerships in this. So together with Parkinson's Net and Buurtzorg, we're trying to enroll internationally together with Philips and Salesforce. And I would love to have MaRS incorporated in that, because to be honest, prior to the moment in time when I got here, I don't know where you're hidden this planet. But in Europe, nobody has ever heard of MaRS yet. Luckily, the Queen and the King will visit you in the next day, so we're going to solve that really in the next weeks. And in November of this year, we will start a new association, which is called the Global Network of Healthcare Innovation Centers. And already these parties are talking together with us to create this movement to share stuff, because we will run into the same hurdles and the same problems over and over again. Healthcare is getting globalized. We need a global reimbursement system. We need to educate our lawyers that the stuff that we're doing really matters and is not all field-proof, but we have to create those kind of things. And just like I said earlier on, Apple is becoming an academic medical center. With one push button, Tim Cook created 700 million research devices. And Stanford University, within 48 hours, included in their research about 18,000 people in their study. That's as much as 50 academic medical centers will create in a year normally. And already it's about like 70,000 people. If you want to read more about this, I could really advise this book. Eric Topol, former cardiologist of Cleveland Clinic. Have a peek at the title. The patient will see you now. And that's exactly what is going to happen. So it's going to be a tipping point in 2015. I completely agree with that. And this is the title of my new book. I'm wrapping this up. The tipping point of healthcare. Times are changing very fast. This little device is going to hit the market for about like $200 in a couple of months. Already there's a Chinese competitor for $400 that's running the same thing. And I've been approached by a Korean company that is going to do that for $50 with double the features. So prior to the moment in time when we got this research protocol ready, it's outdated already. That's our new world. So it's going to be a bumpy road. It's going to be a roller coaster. And I cannot wait, to be honest, to be in there. And hopefully you will join us in that bumpy ride. We cannot skip it, by the way. Some executive thinks that we can skip this phase. That's not possible. So, there we go. So let's create this pillar movement in healthcare and flip them around and create rocket pipes on them and try to take the challenge and to firestart. And hopefully you'll join me with that. About this and a lot of other stuff I'm writing on my LinkedIn blog. And thank you for your attention, Roy.